Good morning and welcome to the first Trevor Phillips on Sunday of 2022. I'd love to be able to say a Happy New Year to you, but it's just hours since we learnt that the toll of COVID deaths in the UK has passed 150,000. For many viewers, this year will have begun on anything but a happy note. And as of this morning, there is no question that the biggest story in town remains the battle against COVID. But the virus isn't the only issue roiling the political landscape, with looming tax rises, energy price hikes, and the threat of inflation stalking the land. I reckon we'll also be worrying away at the prospects for the economy in the weeks to come. Abroad, Brexit clearly isn't done yet, and I think we can count on Vladimir Putin to keep us interested in foreign affairs. While here at home, after the court verdict on the Colston 4 in Bristol, we have our own wars already in progress. The culture wars, as they're being called. So plenty to keep us busy for the next 60 minutes and a stellar lineup today to tackle those touchy topics. It's the first week of term in Westminster and in schools up and down the country, so appropriately enough, I'll be joined by the Education Secretary Nadim Zahawi. With millions of people worried about upcoming big rises in tax and energy prices, we'll hear what Labour would do from Shadow Chancellor Rachel Reeves. There's a stark difference in approaches to COVID between England and the other nations of the UK, so we'll talk to Welsh First Minister Mark Drakeford. London was the first part of the UK to be hit hard by Omicron, so we'll try to get a clearer picture of the state of COVID in the capital and what it means for the rest of the country from Public Health Director for London, Professor Kevin Fenton. It's the impact of Omicron on the NHS that's the biggest concern, with months of winter ahead. So we'll speak to Professor Dame Anne Johnson, President of the Academy of Medical Sciences. But as I said, there's more than COVID to talk about. Liz Truss now runs negotiations with the EU over Brexit arrangements in Northern Ireland and says she'll invoke Article 16 if the EU doesn't compromise. So we'll hear from Ambassador to the UK, Joao Vale de Almeida. And earlier this week, 4 people who pulled down the Bristol statue of slave trader Edward Colston were cleared by a jury, with politicians from all sides weighing in. But what do Bristolians think? I'll talk to the city's mayor, Marvin Rees. But first, I'm joined by the Education Secretary Nadim Zahawi. Good morning, Secretary of State.
Morning, sir.
Can we just start with the state of play? Yesterday, 150,000 deaths. Looking back, can we really say that all of those deaths were unavoidable?
Well, of course, we will learn the lessons of how we dealt with the pandemic through the inquiry that we've announced. And that is the right way to do this. One of those 150,000 was my uncle. He was eligible for a vaccine. Sadly, he contracted COVID before we could get him vaccinated. So then we had to wait for that period. But unfortunately, it became very severe and we lost him to this evil virus. So it brings it home to me and to many families that the 150,000 are not just numbers, statistics. They are parents, grandparents, uncles, aunts, husbands, wives. So it is important that we learn those lessons, and that inquiry will be able to deliver that. In the meantime, we continue to deal with this virus, with Omicron, which is the infection rates are a quantum higher than Delta. But thankfully, the booster seems to be working incredibly well. And you look at although the number of people going into hospital is rising still, but actually the people on ICU has been coming down, which again demonstrates that the vaccines are the best way out of this pandemic, because they, again, weaken the link between infection rates and severe infection, and of course hospitalization and death, thankfully. So 90% of over 12-year-olds now have had a single vaccine, which is great to see that uptake and vaccine hesitancy decreasing, including, of course, over the Christmas period. Many people who've never been vaccinated came forward to be vaccinated. And 90% over 50s have had a booster. And so I'm confident that the way out of this, and as we transition this virus from pandemic to endemic, I hope we'll be one of the first you asked me the question, how well we've reformed. I hope we'll be one of the first major economies to demonstrate to the world how you transition from pandemic to endemic and then deal with this, however long it remains with us, whether 5, 6, 7, 10 years.
I want to unpack that, but just before we leave the 150,000 figure, there will be families like your own who they will, I won't say look forward, but they will be anticipating the inquiry. But your relatives and families like yours probably already know that, and this is not pointing the finger, but they probably already know that much of what we did was too little too late, wasn't it?
I don't agree with that. And if you look at my role in this with the vaccine deployment...
You were the success.
Well, but also we've had many successes. So one of the big successes now, obviously, is the antivirals. And Sajid Javid, the Health Secretary, has ordered over 5 million antivirals. Of course, the success is testing. We've tested twice as many people in the UK than France has done, I think about 4 times, and Germany has done. Over the past 2 years, we've done 400 million plus tests. If I tell you that in January alone, we've ordered 425 million lateral flow devices. People can get their tests. Schools opened last week. We asked secondary schools to test at school. We got 31 million kits delivered because I got them to order from November, and we had a different supply chain for schools. We're going to get another 17.6 million out by this week. And so there's many successes in terms of our diagnostics capability. We had not much diagnostics capability to speak of in the UK. Now we are a behemoth when it comes to testing, diagnostics, and of course, vaccination. Not just for the UK, but for the rest of the world as well.
Let's talk about where we go from here. You have already said this morning that you think that we are moving from pandemic to endemic. Let's talk about some of the signals of that. When do you want the isolation period to move from 7 days to 5 days?
So the UK Health and Security Agency did a very good blog on this, and your viewers should actually have a look at that. And what they looked at is, because people said, the Americans at 5 days, why are we at 7 days? Actually, we begin our isolation period when people get symptoms. In the US, it's when they test positive. So we have to be careful as to whether we move, because what you could end up is actually a perverse incentive where the spike is higher because people come out of isolation too early. But they said they will review it, and if the evidence is there, where if you are asymptomatic and you are vaccinated and boosted, and you have 2 days, consecutive days of negative lateral flow tests, they said they will keep that under review. Of course, it would help
And you want that to happen as soon as possible?
Well, I would obviously always defer to the scientific advice on this. It would certainly, help mitigate some of the pressures on, schools, on critical workforce and others. But I would absolutely be, driven by the advice from the experts, the scientists, on whether we should move to 5 days from 7 days. Otherwise, what you don't want is obviously to create the wrong outcome by higher levels of infection.
Well, you want that to happen. Another suggestion that's apparently coming forward, and I think you are associated with this, that lateral flow tests at some point are going to have to stop being free. If this is an endemic condition, when do you want that to happen?
I saw that story this morning, which I was slightly puzzled by, because I don't recognise it at all. This is absolutely not where we are at. On the contrary, I've just said to you in my opening remarks that for January alone, we've got 425 million lateral flow tests coming in, and they'll continue to be available for free, because actually we've got 3 lines of defence. The booster, and obviously vaccination if you haven't been vaccinated, testing, and antivirals. And all those 3 things are really... So I don't really recognise where that story is coming from.
So to be clear, there are no plans at the moment...
Absolutely not.
...to stop lateral flow tests being free?
Absolutely not.
The former head of the vaccine task force says that we should end the mass vaccination campaign after this booster round and move to something called normality. Do you think that's right? 3rd booster, and then we treat this like normal annual flu?
Well, one of the, actually real great things we have in the UK is people like Clive Dix, who you're referring to, and of course Kate Bingham and Richard Sykes, who's now chairing the Vaccines Task Force, and others who are brilliant Brits who are world experts in this area. So I would certainly look at the evidence. All I would say is actually we know that the booster campaign has worked incredibly well in terms of preventing infection, but also in preventing hospitalisation. And so we want to continue with that. I would obviously look at what the JCVI would say on this for future variants, because we are going to have to live with this virus. It will deliver other variants this year, next year and beyond. And I think the great thing is vaccines are getting better. So we're getting, polyvalent, multivalent vaccines that will deliver greater protection against many other variants of the virus, as well as, of course, the antiviral. So we will continue to improve, but live with it.
That's a future. You're painting a pretty optimistic picture this morning, but let's be clear. From the A&E wards of our hospitals, it doesn't quite look like that. Ambulances are having to wait to move patients into beds. You're bringing military personnel in to help. Health leaders are saying there could be 25% down in staff numbers. Staff absence tripled since the beginning of December. The truth is, the system is already pretty near collapse. And that's today's problem rather than the sunlit uplands of tomorrow, isn't it?
So the first thing to say on that is the ambulance units, and we've got 4,000 now, I think a 500 increase on what we had pre-COVID. The NHS frontline, the NHS support staff have done a tremendous job. If you look at the hospitals...
We've got to deal with where we are today.
Absolutely. So they are under pressure because, obviously, of the quantum higher infection rates with Omicron versus Delta, and therefore that 7-day isolation period associated with that. But if you look at the number of hospital trusts that have declared a critical incident, there's 24.
Indeed.
Right? Which
a lot.
There's about 130 plus hospital trusts. Out of that, there's 24. In 2017-18, 23 hospital trusts declared a critical incident. So it is a mechanism that the NHS uses very well in times of very high pressure on the system. The NHS is very good because they've got this ability to digital passport staff between trusts. That's also capable. We are launching 8 Nightingale sites. We are probably going beyond that to increase capacity as well. There are now 10,000 plus additional nurses in the NHS, 4,000 plus additional doctors in the NHS.
I am getting the list of your output.
Yes.
What I'm putting to you, however, is that there are doctors who are saying we're on our knees. There are nurses who are saying the shifts are not, that we're depleted in each shift. There are people who are saying that actually we're not getting treatments because, and Sky had done reports, people who have lost relatives because of the crisis in hospitals. Now, you can tell me all of the things that you're doing, but the point is, actually, the more you tell me that you're doing, the more I wonder if it's enough, because actually, if you're doing all of this and we're still having this situation, there's a crisis. Aren't you being a bit complacent?
Not at all. It is, as Sajid Javid said, it is a rocky few weeks. I would say this is a really tough time. That is absolutely right, because obviously we've got people who are absent because of having to self-isolate. But what we're doing is doing everything we can to make sure that the NHS has the ability to ride out this bump in the road for the virus. Within that is the additional $5 billion for just this 6 months of money being made available by the Chancellor, Rishi Sunak, to help the NHS weather this storm. And that's the right thing to do, including, by the way, for example, in 1 week, we've had overseas nurses, something like 900 overseas nurses registered in 1 week. So we know that there are staffing pressures, but we're trying to mitigate against them by recruiting more nurses, 50,000 over this Parliament.
All right.
Doctors,
Let me come...
And, of course, the military helping, and other parts of
Let me come back
that.
to your own particular responsibility. You're sending ventilator kits to schools, you've mandated masks, but you're not going to know the effect of the return. Are you sure you've done as much as you could do?
We are continuing to monitor the situation. So what we did was, before Christmas, we made sure schools ordered their kits for the testing. Before that, in November, we got 350,000 CO2 monitors at the cost of £25 million so that we can monitor the atmosphere in the classrooms. From that data, we're able to model to say, actually, we need about 8,000 air purifiers for those classrooms that need the help that they can't mitigate for making sure the air is circulated and fresh in the classroom. We're getting those out this coming week. Obviously, we prioritise special schools and schools in alternative provision because those kids are the most vulnerable. And, of course, as of Monday, we continue the school vaccination programme.
Do you feel assured we're not going to have to send children home or close schools?
So I will do everything in my power. I was at Hammersmith Academy last week, and I saw how brilliantly they did with testing their pupils and getting back to education. School leaders, teachers, by the way, the support staff, and a big shout out to the support staff, because without them, we couldn't do any of this. I'm confident we'll be able to cope.
I don't want to cut you short, but I do want to talk to you about the economy, because, of course, that is actually, for most people, the thing that is looming. It's not looking great. Most people are going to see an actual cut in their take-home in April because of tax rises. We are likely to see an energy price rise, could be anything up to several £100s a month for the average household. And right behind that, inflation coming down the track. Why don't you reconsider, as I think some of your cabinet colleagues want, the rise in national insurance? Because the cost of living is going to be catastrophic. Rise could be catastrophic.
So let me just pull you up on your first sentence. The UK economy, because of the action we took over COVID and how we've coped with Omicron, is going to be one of the fastest growing economies in the G20.
Yeah. We can have an argument about GDP numbers. What I want to talk to you about is household budgets.
I hear you.
And what people feel like.
Right. And so what's the best way for people to cope with the cost of living? Is to have a job, right? We have the highest level of employment.
Hold on. This is a great answer. But I'm talking to you about people who have jobs, who are in work, who are going to find that there are hundreds of pounds coming out of their pocket because of your tax rises. Deal with that.
Right. So allow me to finish that point. So who are those people? Those people are the people on universal credit. Right, the taper. No, some of them are.
You keep going off into a direction rather than the one that answering my question.
I am answering the question.
The average household, a lot of whom are in jobs, not in receipt of benefits. They will feel the tax rise and the price rise. Why not deal with that?
Okay, so the national living wage going up to £9.50 in April, same time, right? The universal credit taper does make a difference, about £1,000 for those who are probably finding it most difficult to cope. The energy price cap remains in place. £500 million to local government because they know which families need the most help with those utility bills. £500 million going to them, as well as the winter fuel allowance, which is a £140 rebate. That will rise to £150 in October, taking more people. It takes in 2.2 million people, 2.7 million people in October.
You're not talking about people who are in work. Look,
they are in work. Why wouldn't they be in work? They are in work, Trevor.
We're coming to the end of this, but and we can talk around this a lot. But isn't the fundamental problem here that your Chancellor doesn't appear to have a plan to ease the pressure on household budgets? I know you can talk about the people who are at the margins and so on, but the average household is what I'm asking about. The Business Secretary doesn't seem to have a new plan to support businesses ravaged by COVID, no furlough or anything like that. I don't know what you're going to do about sick teachers. The point is, the government doesn't really feel like it's got a plan to deal with this cost of living crisis. Prime Minister seems to be saying, put my hands together and then pray.
No, not true. I tell you for what. You asked me about the NIC, right? Okay. Let's look at that, right? Now, we know that 36 billion is absolutely the right thing to do to deal with adult social care and the backlog of the NHS, right? Who's paying for it? 14% of the highest earners pay 50% of that rise. 6.6 million of those who really are right at the bottom of earning pay nothing for the NIC.
Okay.
So it's worth putting in perspective. It is as progressive as you can be whilst delivering on adult social care and the backlog of the NHS. That makes a huge difference. The business secretary is meeting literally all the time to deal with the energy spike in gas prices.
I'm sorry, I'm going to have to stop you because we have other guests waiting. And I am sure you and I are going to have this conversation many times in the coming weeks. Thank you for your time this morning.
Thank you.
Now, let's go to hear Labour's take on all of this. The Shadow Chancellor, Rachel Reeves, joins me from central London. Good morning, Shadow Chancellor. I'm going to come to you on the things I've been discussing with the Education Secretary in a second. But you said this morning that your big plan to deal with this cost of living crisis is a windfall tax on North Sea oil and gas producers. How's that going to work in a declining industry and one which basically isn't producing much in the way of profits at the moment anyway?
Well, we've had 10 years, more than a decade, of dither and delay and incompetence from this government, which is why we have this energy price crisis today. Of course, prices have gone up globally, but we are uniquely exposed in Britain because of the decisions of this government. It's a failure to regulate properly, to get rid of our gas storage, and a failure to retrofit homes and to go with the speed on new nuclear and renewables that are necessary. And that's why today I'm putting forward a package of measures to keep bills down this April, to help families and pensioners who are struggling with this cost of living crisis that is coming in April. And it is right to ask those who have benefited from higher gas and oil prices to pay more into the system. And that's why I'm putting forward a one-off increase in the taxes paid by North Sea oil and gas. They are likely to make record profits this year because of that spike in prices. Let's tax them a bit more and use that money to reduce bills for ordinary people who are struggling so much at the moment. And we estimate that just because of the higher prices, already the oil and gas industry in the North Sea are likely to pay £2.3 billion more in tax. A one-off windfall tax will raise an additional £1.2 billion. Let's put that money into keeping bills lower for everybody else.
OK, with respect, Shadow Chancellor, it's OK for you to say that they're having a terrific time because of the temporary spike in oil prices, but from those in the industry who actually have to pay the bills, they are saying that hasn't particularly helped them and actually things are going pretty much south. So how do you respond to their view that actually it may help somebody, but it certainly isn't helping them, and that what you might be doing is preparing for the decimation of our energy sector?
Well, chancellors have used this device before of increasing taxes on North Sea oil and gas when revenues and profits are particularly high. The previous Chancellor, George Osborne, did it in 2011, Gordon Brown, and before him, Margaret Thatcher also increased taxes for a short period of time on North Sea oil and gas when prices were particularly high and those windfall profits were being made. Any chancellor, any shadow chancellor has to make choices about where to tax and where to spend. I want to tax fairly and spend wisely. But when those excess profits are being made, it does make sense to have a windfall tax and use that money to keep bills down for everybody else. Because unless action is taken, and taken soon, millions of families and pensioners across the country are staring into a huge cost of living crisis. As you said earlier, Trevor, an increase in national insurance at the same time that and electricity bills are going to explode, potentially up by £700 a year for bill payers. We cannot stand by, as the government are currently doing, and allowing those price increases to go ahead when action can be taken now to reduce bills, especially for those who are the squeezed middle on lower incomes, pensioner families as well. Action has to be taken to avert this crisis that is coming down the line.
OK, just one more chance on this. I'm not going to argue with you about the nature of the problem. I'm asking about the nature of the solution. You are projecting a windfall tax on a declining industry. Reserves are declining, which already says it's squeezed. And actually, the big oil companies are going elsewhere to develop. Are you happy to project a plan which essentially will make Britain more dependent on energy supplies from others? For example, Mr. Putin's got lots of oil and gas. Are you happy that we are making him smile this morning by saying we might have to depend more on him?
My plan, Trevor, is the exact opposite. We need to wean ourselves off imported gas from Russia and Qatar and elsewhere. And that's why, in the plan that I'm setting out today, is also a big boost in investment in renewables and in nuclear, in our hydrogen industry, so we are not reliant. That is why the UK is uniquely exposed, because the government got rid of the gas reserves, has dithered and delayed for over a decade on new nuclear and in investment in renewables. And as a result, we are particularly exposed to that imported gas from countries like Russia, who do have us over a barrel. And that is why, as well as a short-term action to keep prices down, we've got to retrofit homes, speed up that investment in new nuclear and renewables, and ensure that we are never in this position again. Because as I say, the UK is uniquely exposed to these rising gas prices because of a failure for over a decade now by this government to take action. And that's why Keir Starmer and myself, working with Ed Miliband, our Shadow Secretary of State for Climate and Net Zero, have put forward this balanced package of measures to keep prices low by asking those who are making big profits this year to pay more into the system for this 1 year only.
Forgive me, I know it's a bit tricky because of the technicalities today that you can't hear me interrupting, but forgive me interrupting you, but the other part of your plan is to cut VAT on energy bills. That's a bit odd for a Labour Shadow Chancellor, isn't it? Because that would benefit richer households relative to poorer households. Why not just simply go straight to the tax system? I mean, that would be a progressive step rather than a regressive way of dealing with the problem.
I'm setting out today 3 things to keep bills low. First of all, a cut in VAT on gas and electricity bills from 5% to 0 for 1 year, saving households, given the price rise we're expected to see, £100 a year. The second thing is smoothing some of the costs of the increase that we're likely to see in April to take a further £100 off bills, but recognising that it is those on lower incomes, families and pensioners as well as those who the squeezed middle, who are struggling with those rising bills and rising tax, putting extra support through the Warms Homes discount to ensure that those people get the help that is needed. An extra £400 off their bills from April this year to help them through this difficult time with the prices high. And you'll know, Trevor, that the Prime Minister was the biggest advocate for cutting VAT on gas and electricity bills during the European referendum. But now, when cutting those bills would make more difference than ever, the Prime Minister says no. Well, I say that bills can't be paid on broken promises. The government should honour that commitment that the Prime Minister made to take VAT off gas and electricity prices. If this isn't the time to do it, then frankly, I don't know when is.
It's a bit odd, Rachel Reeves, to hear you saying you want to follow a Boris Johnson policy. And I don't think you've quite dealt with my question about whether this is not a regressive tax on households, and wouldn't a Labour approach be to impose a more progressive tax so that you're not putting a relatively higher burden on the low paid? You can do all the other things that you've mentioned. I hear all that. But this particular cut would mean that better off households benefit relative to the poor. Why are you doing that?
Well, in fact, it is poorer households who spend a higher proportion of their spending on gas and electricity bills. And that is particularly so for pensioner households who are at home more and need to keep their homes warm. So I don't buy this idea that cutting VAT is somehow a regressive policy. But we are making sure that through this package of measures we're announcing today and the windfall tax on those excess profits of North Sea oil and gas are used particularly to benefit those people on lower incomes, families and pensioners, with additional support through the Warm Homes discount. So support for all with that cut in VAT, but extra support for those who need it most. That is the progressive thing to do, but it also recognises that everybody right now is facing, through no fault of their own, big increases in prices in April. Government can do something about it. They must choose to act, because without action, a combination of national insurance increases, council tax increases, and this catastrophe of higher domestic gas and electricity bills will be a disaster for families and pensioners in just a couple of months' time.
Rachel Reeves, thank you very much for your time this morning.
Thank you.
Now, the nations of the United Kingdom have gone their separate ways when it's come to responding to the threat posed by the Omicron variant. Scotland, Northern Ireland and Wales have imposed more stringent restrictions, while in England, Boris Johnson says he hopes to ride it out under current Plan B rules. The Welsh First Minister, Mark Drakeford, has been withering in his criticism of the approach in England. He called England an outlier that doesn't take the action needed to protect its own population. Well, he joins me now. Good morning, First Minister. Do you think that Wales is in some way in danger from England's policies?
Well, I've agreed with the Prime Minister many times that it is better to have single messages across the United Kingdom, that allows us to communicate the seriousness of the position and the measures we ask individual citizens to take in their own lives. So when we have different messages across our border, that does make it more difficult for us. But we faced this in the past. We go on doing, as we see it, the right thing to protect lives and livelihoods here in Wales.
First Minister, Wales currently has a higher incidence of COVID despite the restrictions. Surely, well, first of all, explain, why is that the case?
Well, actually, I think it's a misleading comparison because there are parts of Wales which are much lower than other parts of Wales and parts of Wales which are much lower than the hotspots in England. So comparing the whole of Wales and the whole of England simply doesn't get to where the real nub of the issue lies. We are trying to make sure that we protect Wales from the onslaught of the Omicron variant, which has moved east to west, coming into Wales later than in parts of England. Our rates are still lower than English hotspots, and we'd like to do our very best to keep it that way.
Well, it's a little unfair then to criticise the English if you are saying that the situation in Wales is varied as it is in England. It's a bit unfair to criticise the government in England, isn't it?
Well, look, the point I make is simply this. I'm asked time after time, why isn't Wales doing the same things as England? And my answer was to point out that in this debate, it is not Wales that is the outlier. Wales is following the same path of putting protections in place that is being followed by Scotland, Northern Ireland, and not just devolved governments in the United Kingdom, but governments across Europe and across the world. The questions as to why the UK government has decided not to follow that course of action are for them to answer, not for me. I think they have not done what the science would have told them they should do. But that's decisions for them to answer for. I'm answerable for the decisions we take here in Wales.
On Wales itself, how long do you want the restrictions to be held in place? And do you have a plan potentially to increase those restrictions?
Well, first of all, we want the restrictions to be in place for as short a time as possible. There is a little bit of good news in that the modelling we have shows a very steep rise in Omicron cases, and we're not at the top of that wave yet. But once we get to the top, the modelling shows a relatively rapid decline from that peak as well. So as soon as we are in a position to see the peak passed and the position improving, of course, we will want to revert to the more modest level of protections we had in place only a few weeks ago. We're hopeful that the level of protections we currently have in place will be sufficient to mitigate the impact of Omicron, to help our NHS to deal with the astonishing pressures which it's having to deal with every day. And we announced on Friday that the current level of protections will remain in place for the next week.
You're sounding quite optimistic. When do you think you might then start to ease the restrictions in Wales? Because I think you yourself have said, and some of your colleagues have pointed to the absolute, not devastation, but the serious impact on the Welsh economy of those restrictions.
Well, can I just make this point? I completely reject the way in which UK ministers very often try to play the economy off against the needs of public health. If we don't attend to the public health needs, the economy is simply affected in a different way because we see very large numbers of people unable to be in work, not confident to go out shopping or to restaurants and so on. So the measures we take to protect public health are exactly the measures that protect the economy. Now, our modelling shows that within about 2 weeks, we will begin to pass the peak. And then as we come down, and we're confident we're coming down, that's when we will look to begin to move back from the current protections.
So we might expect some new news in a couple of weeks. Can I just ask you very quickly one last question about a specific situation? Sky News is reporting yesterday that the non-league English football club, Chester, could go out of business because its stadium is in Wales and officials are targeting them over possible rule breaches. Will the Welsh Government step in to try to sort this out, help Chester stay alive?
Well, I've already asked my senior officials to have discussions today with the police, with the club, with the local authority that owns the ground, the Chester local authority. I'm sure there is a sensible, pragmatic solution here that doesn't mean that the club is placed in jeopardy, but doesn't result in the law being broken either.
Mark Drakeford, thank you so much for your time this morning. London's been the front line of the Omicron crisis. Huge numbers of infections, thousands of NHS and other public service staff off sick, and now the military being sent in to support overstretched hospitals. But it's also where we might just be starting to see a glimmer of light at the end of the tunnel, with talk of us reaching or even getting past the peak of new cases and hospital admissions. Let's try to find out what's happening in the capital and what it means for the rest of the country. Professor Kevin Fenton is the Public Health Regional Director for London. Good morning, Professor Fenton.
Good morning, Trevor.
Has the Omicron wave reached its peak in London?
Well, we think we may have passed or are at the peak. Data from the ONS suggests that the peak may have occurred at or just about the New Year period. And we're seeing reductions in overall case rates across the city and the prevalence of infection within the community. But remember that infection levels are still very, very high. And the ONS figures suggest that nearly 1 in 10 Londoners are still infected with the disease. So it means that we're not yet out of this critical phase of the pandemic, although we may well be past the peak.
But what we do know is that you probably have more data than anybody else, and you can probably tell us more about Omicron itself. Is it correct, as people now seem to be saying, that the evidence suggests that it's milder and that it will come and go faster than Delta.
Yes, I mean, when we looked at the data from South Africa, we saw the sort of explosive growth and then the rapid reductions in infection. We're not yet seeing the rapid reductions in infection levels in the city. But what we have seen over the past few weeks is that as we've gone through the pandemic, we have seen significant numbers of people becoming infected, a lot of pressure on our general beds in hospitals across London, but thankfully less pressure on our ICU beds. And the reason we've seen that, Trevor, is because of the high levels of vaccination that we have across the city. And the most pressure that we have are from people who are unvaccinated or incompletely vaccinated. And that's where we're seeing the pressure on the hospital systems. And that's why we're putting so much effort across the city to getting people vaccinated, getting their boosters, even if they haven't been vaccinated to this point.
I want to come back to this question of the unvaccinated in a second, but let's just stick for a moment, if we may, with the position of the NHS. I know nobody can absolutely predict this, but is it your feeling that London's hospitals will be able to cope this winter?
Well, it certainly is our hope. We are seeing a slowing down in the rate of increase of patients with COVID being admitted to London hospitals. And that's really good news. But as you said at the top of the story, there are other pressures that we're facing currently across our health system in the city. So, for example, we have relatively higher staff sickness absence rates, some of which are from COVID, but there may be other respiratory illnesses which are also causing challenges as well. And of course, we have the usual winter pressures, which we see as we move through January and February. And as we emerge from the New Year period, we're seeing more people presenting to our hospital services with the sort of heart disease, the things that we would normally see in the winter. So there's three things: COVID, staff sickness absence, as well as winter pressures, means that for the hospitals in London, we're still in a critical phase.
I think you've recently picked out a specific thing and said that you're worried about the rising number of cases amongst the over 60s in London. Do you think that's a particular issue, and will it lead to more hospitalizations and serious cases of COVID?
Yes, that's a great point. And we're watching it really, really carefully. What we've learned from waves 1 and waves 2 is that one of the strongest predictors of your likelihood of hospitalization is being in that over 60 age group. And of course, if you're unvaccinated. And as the rates are continuing to increase in that age group, we're looking really carefully at the pressures that it's placing on our systems. Thankfully, we have very high rates of vaccination and booster coverage in our over 60s in London. So we're hoping that even if we're seeing increasing infections, that it won't translate into significant pressures in our hospitals, and especially in ICU beds. And this really is the power of the vaccinations that we have, Trevor, because it really does prevent severe disease and death from Omicron and all other variants of the virus.
Well, that takes us actually to a point you made earlier on, which is about the unvaccinated. For the last 6 or 7 months or so, health officials like yourself have been telling us there needs to be a process of education and so on. Well, actually, what we're probably now seeing is that there is a hardcore of people who say, I know all about it, I just don't want to have it. I mean, Piers Corbyn, the leader of the anti-vax movement in London, is not an uneducated man. He's an astrophysicist and a PhD. He understands the science. He just doesn't want to have it. What is your plan to deal with those who are literally convinced, sincere anti-vaxxers?
Well, we must remember, Trevor, that segment of the population is very, very, very small. The people who are sort of very strong anti-vaxxer, who hold those views. For the vast majority of Londoners, we know that there are 3 reasons why people don't get vaccinated. The first is that, it's an issue of convenience and access and their ability to navigate the system. Many Londoners may not have English as their first language. So we have to do the work of going into communities, engaging with those individuals and ensuring that we have good access to the vaccines. Another reason in London is that many, especially our younger people, may have become infected with the virus during the course of the pandemic. And so they may feel less inclined to take the vaccine because they believe they're already protected because they've been exposed. And for this group, we're ensuring that we have strong messages about the power of the vaccination combined with prior infection to help to protect you moving forward. So these are other reasons why people aren't getting the vaccines. And I think we need to focus on those and work with those individuals and communities rather than trying to convince people who are absolutely not willing to take the vaccine.
Professor Fenton, thank you so much.
Great. Thank you.
Dozens of NHS trusts across the UK have declared critical incidents as growing COVID admissions and widespread staff sickness stretch hospitals to their limits. So just how tough is it for health service staff right now? What could the rest of the winter look like as the system struggles to, in the Prime Minister's words, ride the wave of Omicron? Professor Dayman Johnson is president of the Academy of Medical Sciences. Good morning, Professor Johnson. Looking at the position nationally, I've just been talking to Kevin Fenton in London, but looking at the position nationally, how far do you think we are into this Omicron wave?
Well, it's important to note that there's been big variability across the country. We saw this wave arrive first in London. And if we look across the rest of the country, the rates of infection are still increasing in all areas except London. You heard from Kevin Fenton that there may be some slowing in London. We're not seeing that elsewhere. So other parts of the country are still are still seeing rises, and we don't know how far that's going to continue. That said, rates in London are still higher than in the rest of the country.
The Health Secretary says that we don't need boosters, or a second booster, I beg your pardon. Do you agree with that?
Well, I think there's very good news coming from the UKHSA this week, and also from the considerations of the Joint Committee on Vaccinations. And what they've shown now with new data is that if we look at people who've had the booster, who are over 65 and are now 3 months from their booster, what we're seeing is that the boosters are holding up in terms of greatly reducing the risk of having to be admitted into hospital. And that's a really important result, even though we know that people 3 months beyond the booster have less protection from getting infected. Nevertheless, they retain the protection from having been admitted to hospital. So that's a very important result. But obviously, this will be kept under review as we get more data moving forward.
An important issue here is how people behave and how they respond to the information that's put out there. Now, I've just been talking to, as you heard, Kevin Fenton, and he was saying young people who feel that they've had COVID think that to some extent they're immune, they don't need to be bothered with the vaccination and so on. What more broadly, people are now believing, and there's some evidence, that Omicron is less severe than Delta. Are you worried at all that what's now going to happen is that people might be less cautious because they think, to some extent, we're coming out of the woods?
Well, I think it's very important that we recognise that people have substantially changed their behaviour during this wave and since Plan B. So the data show increased use of face coverings in crowded places. People are clearly using tests when they're going to mix, particularly with people more vulnerable than themselves. So people are assessing the risk. Moving forward, though, we need to recognise that we are now building up immunity in the population, both through vaccination and through natural infection. What will be important in the future is what whether other variants emerge that are either have caused more or less illness. So we're going to have to keep a close eye on that. But people have responded quite substantially. My concern now would be going forward, is we will see changes in behaviour again, obviously, as schools go back, people return to work. So there'll be different patterns of behaviour, and we'll have to watch very carefully how much infection goes on being transmitted. But we also need to think about how we most effectively respond in terms of, for example, being able to keep people at work and so on.
Of course, I've been saying this morning, COVID is the big story in town, but I think it's probably wise not to forget that there is such a thing as conventional flu. Are you worried about the impact of flu this winter?
Well, I would just remind everybody that every year we see flu being transmitted in the population, and very often the flu season, if you like, doesn't start till the end of December or going into January. So but at the moment we have very limited flu activity. That doesn't mean that we shouldn't see more. What I would emphasise is that we should remember that the pressures on the NHS are not just COVID and Omicron. There are also other respiratory viruses which we see in winter, like respiratory syncytial virus and other viruses. So people are in with other conditions as well. And we need to watch carefully for flu. Two things are important that we've already done to mitigate against that. First is that we've had a very good vaccination programme for flu this year, higher uptake. It's been done along with the boosters. And secondly, the behaviours that people are changing to reduce risk of transmitting COVID will also limit the transmission of other viruses like flu and other respiratory viruses.
Dayman, thank you so much for such a comprehensive briefing this morning.
Thank you.
Now, Brexit negotiations, a phrase that's supposed to be in the rearview mirror by now. Well, far from it. The United Kingdom and the EU are still talking about changes to the arrangements for Northern Ireland. And Foreign Secretary Liz Truss is in the newspapers today saying she's going to take unilateral action and invoke Article 16 to rip up parts of the current agreement if they can't find a new solution. So, is there going to be a deal? And what happens if there isn't? The EU ambassador to the UK, Joao Vale de Almeida, joins me now. Good morning, Mr. Vale de Almeida. Do you think that there is a prospect of the Article 15 being invoked by the government soon?
Well, good morning, Trevor, or I should rather say Sir Trevor. Congratulations. And Happy New Year to you.
You're the first of my guests to tease me about it this morning, but on we go.
Well, I think it's well-deserved, and Happy New Year to you and all the viewers and our friends in the United Kingdom. Listen, we heard this before from the government, so we are not surprised. We are not too impressed, but we still believe it's not very helpful that we keep, agitating the issue of Article 16. I think what we should focus on, at least that's where we are focused on, is trying to find solutions for difficulties in the implementation of the protocol. But let me remind you, Sir Trevor, of a very simple point. The problems arise and were triggered by Brexit, not by the protocol. The protocol tries to mitigate the serious problems created in Northern Ireland by the Brexit and the kind of Brexit that was chosen. So we are focused on solutions. Invoking Article 16 or invoking issues which are not the core concern of citizens and business in Northern Ireland, and we have been listening to them very attentively. So doing Article 16 or enlarging the scope of problems is not going to contribute to find solutions.
By the way, Trevor is fine for this programme. Sir Trevor only happens when I have my horse with me. But just coming back to the point in hand, don't you think that essentially the clock is ticking here? Liz Truss is going to meet the leader in Northern Ireland, Sir Geoffrey Donaldson, this week, and at some point soon we are going to have a solution. Is it time for everybody to get their skates on and start bringing forward some new compromises?
Absolutely. We need a new momentum in these talks, and we are eager to reconnect with the British government, now with the Foreign Secretary, and looking forward to meetings in a few days in Britain. And we are eager to reconnect, but we are even more eager to find compromises, because we need to move on. It's been too long. Just to give you an example, we have listened attentively to Sir Geoffrey and many other leaders, to all the leaders actually in Northern Ireland. We have engaged with the civil society, we have engaged with business. My first official visit out of London was to Northern Ireland. Vice President Šefčovič, who is the interlocutor of Liz Truss, has been there as well as in constant contact. We identified the problems, and in October, we put forward a very ambitious package of measures that deals with all the main issues, the core concerns, the difficulties in implementing the protocol. We now want this to be fully discussed, and I hope that, at least we expect that from the British government to reciprocate on our offer of October and get down to concrete, practical solutions. That's our spirit, that's our approach, that's our mindset as we approach and we prepare for the meetings in the coming days.
There, of course, is another event approaching that will put new pressure on these negotiations, and that is that there will be elections to the Stormont Assembly in May. And in practice, when this gets mixed up with politics, is that likely to make the negotiation even more complicated?
I don't want to comment on the internal situation of a third country, where I proudly represent the European Union, but I can tell you that we are in close contact with all the political leaders in Northern Ireland, directly or virtually, on a very regular basis, and I think we fully understand all the elements of the complexity of the situation in Northern Ireland. The European Union has been committed for a long time to peace and prosperity in Northern Ireland. We were there since the beginning of the Good Friday Belfast Agreement, and we remain absolutely committed to guarantee peace and security and prosperity in Northern Ireland. And actually, if I may, Trevor, highlight one point. The protocol provides a huge opportunity for Northern Ireland. Just remember that this is the only territory in the world that has access to both the United Kingdom market, but also to 500 million people market, which is the single market of the European Union. So the only territory in the world. So this gives Northern Ireland citizens, Northern Ireland business, a perspective for job creation, for foreign investment, for European investment, but also, I understand, Canadian, American investors are very interested, provided we guarantee that there is predictability and security and stability in Northern Ireland. I think the protocol creates the conditions for that against the background of a Brexit that created enormous problems for Northern Ireland. We had to square the circle together with our British friends. It took a long time. Now we have the protocol, which is international law, British law, EU law. We want to implement it with pragmatism, with a certain degree of flexibility. And that's what we're talking about, and that's what we should talk about in the coming days and weeks. And I share the idea that we need a new momentum. And I hope that the meeting we're having in Chevening this week with the Foreign Secretary will inject a new momentum into these negotiations. That's our hope and that's our commitment.
May I turn to a rather different challenge to the EU and foreign affairs, and that is, of course, the fact that dozens of protesters and 12 police officers, at least we think, have died in ongoing violence in Kazakhstan. Russia has sent troops across the border. How worried is the EU about Russian incursion into its neighbours?
Well, it's good that you mentioned Russia. It's good that you mentioned situation in Kazakhstan, because this is one area of security in our neighborhood. This is one area where the EU and the UK can do a lot together. And my sense in looking at the wider picture is that the sooner we move on from issues that are still open related to Brexit, and particularly the Northern Ireland situation, the sooner we move on from that, the better equipped we will be, the EU and the UK, to work together in addressing very serious issues.
But what can you do? Mr. Putin is not... Mr. Putin doesn't do much responding to warm words, does he? I mean, what can you actually do to stop him doing this kind of thing?
I think, I was in Liverpool in the G7 Foreign Affairs Ministers, chaired by Liz Truss, and we together agreed a very strong statement. The European Union member states have a very common position of strength. The United States is together, the NATO allies are together, and we are saying very clearly, and these are very clear words, that there will be massive consequences and severe cost if Russia adventures into Ukraine with military action. And this is a very, very solid and unified position among ourselves. As you know, today, tomorrow, the days after, there will be important diplomatic initiatives taking place.
Forgive me to interrupting you, but massive consequences, that's a good phrase. Would one massive consequence be for the EU to say to Mr. Putin, if you keep on like this, you can forget about Nord Stream 2 and that flow of revenue from oil and gas into Western Europe?
I don't think we should anticipate action. We should react when action takes place. What we're doing now is trying to de-escalate, using all the diplomatic tools and avenues that are available. If ever Russia moves into other direction, they can be sure that there will be a unified response from our side. And let me give you this also as an example of the need for us to move on in our bilateral relationship, because we share the same values, we share the same strategic interests, and there's a lot we need to do regarding our neighborhood, but also regarding Iran, where we have a very clear joint position with UK, our relationship with other parts of the world.
Thank you.
And the cooperation with the US. So it's a long list. That is awaiting a better climate in our relationship.
Thank you. Ambassador, thank you so much.
Thank you very much.
Now, earlier this week, 4 people were cleared of criminal damage in a Bristol court. Wouldn't even made the pages of the local paper most days, but much of the country saw videos of them pulling down the statue of the slave trader Edward Colston in the city back in June 2020. Now, the Attorney General says she might refer the case to the Court of Appeal, and politicians of all persuasions have been wading into the ongoing row. People we haven't heard much from are Bristolians themselves, so let's put that right now. The Mayor of Bristol, Marvin Rees, joins me. Good morning, Mr. Mayor.
Marvin's
how significant is this case for Bristol?
Well, it depends on your audience, depends on your criteria. In the lives of the 4 individuals, it's incredibly significant, I guess, because their futures have thus, faced a bit of a fork in the road in some ways. For the work on race inequality in Bristol much more widely, it's less significant because, my sense is that, when we're tackling race inequality, we're looking at those underlying drivers of political and economic inequality, and the verdict itself doesn't actually touch on those very real and immediate issues.
So, in essence, you're saying this is really, as far as Bristol's concerned, a rather marginal issue? Well,
it would be noisy, but I'm minded of something someone said to me the other day: "This too shall pass." It's one of the warnings I make all the time, that we have to be careful about symbolic acts and mere events being substituted for acts of real substantial systemic change. Now, make no mistake about it, I don't like the idea of the statue being up in the middle of the city. I'm glad it's not there. I think that the debate around our history, who we choose to celebrate as a country, is important. These are symbols of historical injustice and whose voice is heard. And I think there needs to be work done on this. And I would like to see people who have been involved in kidnap, rape and all the rest of it not celebrated in public space. But at the same time, symbolic acts, while they're important, if they begin to take the place of acts of political and economic policy and real substance, become a problem. Because we look around in 5 years, realize that nothing's really changed. People point to all these things that have happened and we say, oh, but those were just acts, those were just performances. So we have to be very careful in the way we handle these issues.
Is that, in a way, another way of saying what you said rather strikingly the other day, that people shouldn't come to Bristol in the hope of fulfilling their revolutionary fantasies? The problem is you can't stop them, can you?
No, but again, there needs to be the fullness of what I said was, if they're coming to do real political change, to do some of the hard yards. I mean, not all anti-racism work is done with a banner and a T-shirt and a megaphone, right? Some of it's done by looking at housing policy, looking at affordable homes, looking at what we do around making sure people are fed, making tweaks to our mental health system, looking at the number of magistrates we get and going out and recruiting. Stuff that we've done over the last few years that has not hit the headlines, that has not brought tens of thousands of people onto the street, but led just a few years ago to 11 of 33 new magistrates in Bristol coming from Black and Asian backgrounds. That's never happened. And yet we know about the inequalities in the criminal justice system, that plague, and that's a central part of ongoing racial inequality. So it's not all about what gets in the headlines. It's about sometimes those hard yards done in invisibility.
Well, it's pretty clear what your priority here is, and I just want to ask you this, and forgive me, we know each other outside of this kind of encounter. Let me ask you a direct question. As the most senior elected black official in the United Kingdom, if not in Europe, how do you feel about 4 white individuals claiming to represent the feelings of minority Bristolians?
Well, I haven't pored over the things they've been saying, other than them and their barristers saying that we've been inactive in the city, which obviously I've got issues with, and I'll be more than happy to talk to them about what real anti-racism work is. I think the symbolic acts are really important, and they've played a part in Bristol's history. But you're jumping off my back here, and then that takes us into another realm of conversation. More broadly, I think there is a question about what it means to be an ally and what allyship is. Trevor, I'm not overclaiming my significance, but first black mayor in UK, probably the first black mayor of any major European city. There are challenges. If they are saying that racism is real, then surely they would also have enough awareness to say there are probably some issues about race that go with this black guy becoming mayor, of Bristol. And we want to understand what those are before we just railing and start saying that nothing's happened in the face of the reality that many things have actually happened. So I think there are some layers to be pulled back there that actually present a bit of a teachable moment for all parties concerned.
Marvin Rees, Mayor of Bristol, thank you very much indeed for your time this morning.
Thank you.
Welcome to Trevor Phillips, The Take, where we look back at the morning's big interviews and discuss what it all means with our Deputy Political Editor, Sam Coates. Let's get straight into it. Good morning, Sam, and Happy New Year to you. What did you make of what we heard, particularly from Nadim Zahawi?
Good morning, Trevor. Well, it's worth just pausing and reflecting, isn't it, just how fast things are moving at the moment in order to make sense of everything that's going on today. It was barely more than a month ago that we really first got to grips with the existence of Omicron, and since then, Boris Johnson has had to introduce more restrictions, be urged by scientists to go even further and start shutting down non-essential shops in England. He resisted and went into the Christmas break in a very perilous political position. Today, we still have something like 146,000 people testing positive for coronavirus. That number peaking record highs over the last 10 days or so. Twice in the United Kingdom, more than 200,000 people a day getting Omicron. And now we've got different signals, different pulls, politicians in London facing and around the country. What you have at the moment is the government having to tread very carefully because it has been in such a rocky situation, confidence in Boris Johnson somewhat shaken, both having to deal with the potential for an NHS crisis by the sheer number of cases, but huge political pressure to start pulling back from where we are in terms of coronavirus measures. That was what has been reflected this morning in your conversations, particularly with Nadim Zahawi. How do cabinet ministers, how does Boris Johnson manage the fact that there is still a pandemic, yet we do appear to be just over the national peak? If you look at the graph of cases, we're just starting to go down, but numbers still going up outside London. How does he deal with that, and how much does he give into his own party that wants him to ease restrictions in so many different ways as quickly as possible?
Well, let's see if we can get any signals from that interview with Education Secretary Nadim Zahawi. In an interview with the Sunday Times today, Mr. Zahawi said the country was moving from pandemic to endemic. I asked him if this meant that the isolation period could be reduced further and whether free lateral flow tests could soon be a thing of the past.
We have to be careful as to whether we move, because what you could end up is actually a perverse incentive where the spike is higher because people come out of isolation too early. But they said they will review it. Of course, it would help
And you want that to happen as soon as possible?
Well, I would obviously always defer to the scientific advice on this. It would certainly, help mitigate some of the pressures on, schools, on critical workforce and others. But I would absolutely be, driven by the advice from the experts.
Another suggestion that's apparently coming forward, and I think you are associated with this, that lateral flow tests are at some point going to have to stop being free. If this is an endemic condition, when do you want that to happen?
I saw that story this morning, which I was slightly puzzled by because I don't recognise it at all. This is absolutely not where we are at. On the contrary, I've just said to you in my opening remarks that for January alone, we've got 425 million lateral flow tests coming in, and they'll continue to be available for free because actually we've got three lines of defence. The booster, and obviously vaccination if you haven't been vaccinated, testing, and antivirals. And all those three things are really... So I don't really recognise where that story is coming from.
So to be clear, there are no plans at the moment...
Absolutely not.
...to stop lateral flow tests being free?
Absolutely not.
Well, let's bring back in our Deputy Political Editor, Sam Coates. Sam, he's pretty punchy there, wasn't he?
That's right. And I thought that Nadim Zahawi really encapsulated a lot of the government's dilemmas when it comes to handling coronavirus. So take that first point that you were discussing, whether or not to move from a requirement that people with Omicron self-isolate for 7 days down to 5 days after the US did it. Nadim Zahawi perfectly fairly making the point that they measured this differently in the US. But Nadim Zahawi's answer, I think, tells you a lot about where the Conservative Party is. He personally wants to do it. He said, I can see the benefits. And of course, as Education Secretary, you might be able to get more teachers back in classrooms. You can see the benefits for hospitals. But he said that the scientists are quite strongly warning that it's quite hard to go down the same path as the US because in the UK, you can start your clock ticking the day that you get symptoms. And if you do this in the UK, you could just end up missing or allowing people who are still infectious to go back into classrooms, into hospitals, and that would slow the path down from the peak. So that's the dilemma. They want to do it, but the scientists are flashing the red signal. Will it happen? Hard to say, but cabinet ministers going on the record calling for it is a bit of a moment. But then you've got this question about whether or not the government are going to start charging for lateral flow tests. Now, again, I was absolutely fascinated by the way Nadim Zahawi dealt with this. This is the story on the front page of today's Sunday Times. And Nadim Zahawi has just been on your show and said, I don't recognise this. It's absolutely not what we're planning. Well, up to a point, Lord Copper. In fact, Nadim Zahawi's almost faux outrage about this story goes a bit too far. Yes, the government are planning it. Nadim Zahawi is wrong to claim that there's nothing in the government plans to suggest this. It's down in black and white. It's in the government's own COVID recovery plan. Just a few months ago, they wrote, at a later stage, the government's response to the virus changes, universal free provision of lateral flow devices will end and individuals and businesses using the tests will bear the costs. It is only a question of timing. I think without Omicron, this may well have been pretty imminent. There is pressure from the Treasury because of the enormous cost, understandably, of doing this. So Nadim Zahawi, I would dare to say, is simply flat wrong to say that there are no plans to do this. The question is simply when the government do that, and it's understandable that they don't want to do it now. And the government and the opposition, Labour, are saying it would be irresponsible to do it while Omicron cases are so high. So I think the government is getting themselves in a mess on this subject, not least because it looks like the Sunday Times was sort of floating an idea, perhaps to test public opinion on it. But there are risks in doing that. Whoever briefed the Sunday Times now has to have on their conscience the fact that many, many people will see that story and react completely naturally by running to their nearest pharmacy and stocking up because they'll be worried that suddenly there might be a charge attached. Now that, quite frankly, could be irresponsible. If the government, or whoever briefed the Sunday Times, did so without considering the real-life immediate consequences of such a story, well, that shows that the government isn't incapable of acts of self-harm, even in this new year.
Blimey, Sam. Well, frankly, if ministers want to come back and correct themselves, Sky News is always available. Now, I also spoke to the First Minister for Wales, Mark Drakeford, this morning. The Welsh Government's approach to the handling of Omicron variant has been in stark contrast to that in England, with Mr Drakeford and his team introducing restrictions to try and curb cases. So I asked him when he thought the peak of this wave would be.
And we're not at the top of that wave yet, but once we get to the top, the modelling shows a relatively rapid decline from that peak as well. So as soon as we are in a position to see the peak passed and the position improving, of course we will want to revert to the more modest level of protections we had in place only a few weeks ago. We're hopeful that the level of protections we currently have in place will be sufficient to mitigate the impact of Omicron, to help our NHS to deal with the astonishing pressures which it's having to deal with every day. And we announced on Friday that the current level of protections will remain in place for the next week.
Let's bring back in Deputy Political Editor Sam Coates. Sam, this issue of the divergence between the different centres of government in the United Kingdom becoming quite tasty, isn't it?
Yes, it's been one of the features of the coronavirus pandemic for the last 2 years, really. Interestingly, this all comes from a decision very early on to do quite a lot of the health restrictions, or the public health restrictions, using health legislation rather than national security legislation. Why does that matter? Because it means that the devolved administrations, Mark Drakeford's government in Wales, Nicola Sturgeon's in Northern Ireland, and whatever form of government we have in Scotland, and whatever form we have of government in Northern Ireland, can all go separate ways to Westminster, and they have, and they do. And in many ways, that's sensible. One of the fascinating things that we heard this morning, perhaps the thing that will stay with me the most from this morning's show, is that in a moment we'll hear from Kevin Fenton, the public health director from London, saying, look, in London the Omicron wave has probably peaked, and possibly peaked even on New Year's Eve, New Year's Day. But you had Mark Drakeford coming on your show and saying, look, it's going to be 2 weeks before the peak has passed in Wales, and only then, when cases are coming down, and he said he hopes that they'll come down there pretty rapidly, only then can we start to ease the more severe restrictions in Wales. Now, why does this matter? Well, it matters in part because you do have anomalies like the football club that you were talking to Mark Drakeford about, which has the pitch in Wales, in England, but the offices in Wales effectively stymied, but unable to go ahead with matches. But it also matters because there are some in the Conservative administration in Westminster looking to make political capital out of Boris Johnson's decision not to introduce further restrictions, as many and as tight restrictions as was the case in Wales and Scotland just before Christmas. There are limits on the number of people that can gather outside in Wales. You can't, for instance, do a park run, something that ministers in Westminster have highlighted. And cabinet ministers do think that Boris Johnson has some credit to be earned, certainly amongst English voters, by highlighting, for political reasons, the differences between England and Wales. But Mark Drakeford saying, look, I don't think that having differences between the two is a good idea, but the peak is at a different point, and we're doing what we think is right. I think this isn't just a case of public health. The differences between the nations have become an issue of politics, and at a time where the United Kingdom itself feels somewhat fragile, I think it's really interesting to watch these tensions playing out.
Sam, I wanted to just get your take on the economic issues we discussed, because I spoke to the Shadow Chancellor Rachel Reeves, who set out Labour's plan for a one-off tax for oil and gas companies and a corresponding tax cut on VAT.
I'm putting forward a one-off increase in the taxes paid by North Sea oil and gas. They are likely to make record profits this year because of that spike in prices. It is those on lower incomes, families and pensioners as well as those who, the squeezed middle, who are struggling with those rising bills and rising tax, putting extra support through the Warms Homes discount to ensure that those people get the help that is needed. An extra £400 off their bills from April this year to help them through this difficult time with the prices high. And you'll know, Trevor, that the Prime Minister was the biggest advocate for cutting VAT on gas and electricity bills during the European referendum. But now, when cutting those bills would make more difference than ever, the Prime Minister says no. Well, I say, that bills can't be paid on broken promises. It is the poorer households who spend a higher proportion of their spending on gas and electricity bills. And that is particularly so for pensioner households who are at home more and need to keep their homes warm. So I don't buy this idea that cutting VAT is somehow a regressive policy.
Sam, we've only got a few seconds left, but good move by Labour or not?
Well, I think they're looking to grab the initiative on this. Cost of living pressures is going to be the story of 2022. You've got a rise in the energy cap, likely to be in the region of £600 coming in the spring. You've got the national insurance rises coming up in the spring. You've got council tax rising in the spring. I think people are going to find 2022 very, very tough. Maybe VAT cuts are the answer. Currently, the Conservatives rejecting it because it also helps the well-off and money is tight. But I think we're going to keep coming back to this question with Labour and primarily Conservative ministers having to really examine what they can do, what they can afford to do. It's not going to be easy.
Do you think that OK, we haven't got time, apparently. I'm always interested in what Sam has to say, but unfortunately I haven't got time to hear more of it. That's it from Trevor Phillips on Sunday this morning. Stay with us on Sky News for the latest on COVID as the United Kingdom passes the milestone of 150,000 deaths since the beginning of the pandemic. And we're going to see you again next week. This issue is not going to go away, but I think that we are going to be talking a lot more about that last question: the economy, the cost of living, tax rises, national insurance and energy. More on politics in a week's time. And thank you very much to all our guests this morning, and especially, of course, to Sam Coates for his interpretation of the politics. See you next week.